What's a mistake a doctor made that left you dealing with the consequences for the rest of your life? Before we start, don't forget to subscribe to the channel so you don't miss the next videos. I wish you a pleasant viewing experience. Story 1. My doctor ignored my very vocal concerns about the pains and strange symptoms I was having during my twin pregnancy. She missed all the classic signs of twin-to-twin transfusion syndrome, many of which I brought up to her. This led to me not having the treatment soon enough in time to save them. I remember having to decide whether I should bury them or cremate them. Those were the blackest and darkest days of my life. Answer: I am so sorry for your loss. After being pregnant, my one piece of advice to pregnant people is, if you have a concern and you feel dismissed, ask for it to be documented on your chart. I'm glad you think this is normal. Can you document on my chart that I was concerned about XXX and further tests ultrasound labs weren't needed? That'll get your doctor's attention real fast. I hope you're doing better now. Edit spelling. Story 2. I had a tumor in my colon. Over time, it grew and grew and grew, and I suffered multiple symptoms because of it. My doctor decided that my symptoms were PMS female problems. Even as they escalated, he told me to take Midol and get over myself, that women either deal with their issues and get on with life, or lie around whining and wasting people's time. Eventually, the tumor caused a 100 bowel obstruction, and my body started to rot from the inside out. I can't even describe how painful that is. Anyway, I ended up in the ER, was sent for immediate emergency surgery, and ended up having part of my colon and necrotic tissue removed and with a colostomy bag. I went from being a very happy, physically fit and active person to whatever the hell shell of a person I am now. Answer: I just wanted to reach out one bag wearer to another. I don't know if you still have your bag or not, but I cannot imagine the shock of just waking up with one. I had a few weeks' notice, but I also knew it would be a possibility. I hope you are okay. My bag changed my life for the better, but I know I was lucky with a great support network and doctors who listened. Anyway, virtual hug from an internet stranger with no bowel. Story 3. After a bad fall, doctor dismissed the foot pain as a sprain and only operated on the knee. Foot pain continued, but they said wait till the knee heals to be sure because of insurance. If addressed at the time of the injury, insurance would have covered the foot. End result, foot surgery a year later, but it has permanent damage that could have been fixed if they had addressed it right away, and now I have a limp. I'll never forgive them their short-sightedness. I've summited multiple 14ers, but I never will again. Edit. Thanks for the positive feedback, yo. Story 4. I had some pain in my mouth. It felt like it was radiating out from my tooth. I went to my dentist about it, and she said, "Oh, you have a filling on that tooth. It's probably just a little sensitive," and she prescribed me some toothpaste. It worked for a while, but a year later, the pain was back with a vengeance. I went to a new dentist. It was the same drill. A year later, new dentist, same drill. Eventually, it got so bad that I was crying in pain. I woke every day with a horrible headache. My teeth were cracking and ground down because it hurt so much. So finally, I go to a new dentist, crying in pain, and she sees what she thinks is a strange growth in my mouth. She has me get an exploratory root canal. The dentist who does it, another one at her practice since she didn't have time, ABD, I wanted to do it fast, tells me that I'm wasting my time and nothing is wrong with me. He eats his words really fudge quick when he sees that I've got a pus abscess under that tooth and all of my nerves there are straight up dead. I've now switched dentist again to a woman who, when I said I would having pain, immediately sent me to a periodontist, no questions asked. But unfortunately, I still have to live with the cracked and ground down teeth and still likely have to wear a night guard for a long time. Story 5. When I was in labor with my daughter, her heart rate would plummet with every contraction. Every time we questioned it, the nurse would tell us that it was just the monitor slipping. I went in at midnight, had a long labor, and was not examined by a doctor until an hour before she was born, around 2:30 p.m. the next day. By that time, she was in the birth canal and could not be delivered via C-section. She had the cord around her neck and was born blue and not breathing. They revived her and she seemed to be okay. It was months later when she wasn't hitting the normal milestones that we realized something was wrong. She has cerebral palsy and is intellectually disabled. She uses a wheelchair and has to wear diapers. She will be 29 next month and she still lives at home, and we still have to care for her every need. I love her unconditionally, but I always wonder if that nurse had paid attention and gotten a doctor in there on time, how different our lives would be. Story 6. It started with a very loud ringing in my ear, then violent bouts of vertigo. I went to my PCP because I was pretty sure I'd lost hearing in that ear. I will never forget. 28 or old women don't go deaf in one ear. You're imagining things. He said he could make a referral to a neurologist, but it would be 3 to 6 months. Paid out of pocket to go to an ENT, couple $100, who immediately ordered a CT scan. Thankfully, not a brain tumor, but nerve deafness, which could have been prevented by steroids. Another kick in the pants. Insurance didn't cover the CT scan either. If you'd had a brain tumor, it would have been covered, but aren't you glad you don't? Answer: was it labyrinthitis? Same thing happened to me a couple of years ago. Felt like I had food poisoning, vertigo and nausea, and then all of a sudden, hearing loss and tinnitus. Went to the ER after a couple of days where the DR said he couldn't see any reason why that was happening, so gave me a referral to ENT. 3 months later at my APPT, the ENT specialist said I'd be fine if I'd been given steroids within a few daw. Now I have permanent tinnitus. Story 7. It was an orthodontist who decided to straighten my initially not-so-bad bite and may not have been well qualified in maxillofacial orthodontics. As a result, this led to clicking, crunching, and pain. I've heard that many people experience similar problems. If anyone else has this issue, please let me know. A hug. Answer: I'm genetically missing 7 or 8 of my adult teeth. This led to significant teeth gaps as a kid, so when I was about 11 to 15, give or take some months, I had braces. Almost 20 years later, my bite is a mess. My teeth are moving. The fake tooth material they put on my real teeth is chipping slowly away, and I deal with constant clicking and sticking of my jaw. I wonder if any of this could contribute to my chronic headaches and migraines as well. My mom went to a cheaper ortho who allowed payment plans rather than a more credited ortho who was more expensive. I don't blame her. She did the best she could with what she was given, but my God, I dislike my teeth. One dental hygienist even said mine was the weirdest mouth she'd seen. Story 8. Dentist at Aspen Dental told me that every tooth needs a root canal. I partied too hard years being afraid of the dentist, and it cost me a couple teeth. Answer: sadly, even dentists or endodontists at non-chains do this. I have had 4 root canals, but only one was needed. I have a routine visit Tuesday, and I am dreading it. I didn't have good experiences with dentists in childhood, but all the root canals didn't help. Age 39 now. The teeth simply ached from clenching. There was no infection, no sharp pain when biting down, no hot or cold sensitivity. You would have thought a dentist could determine that, but I paid out of pocket and traveled far to see a better dentist who specializes in TMJ and craniofacial pain. I returned to him when I was told I needed a 5th root canal, and he straight up said the endodontist was scamming me. He said he sees it a lot. Patients come in with a mouthful of crowns or implants that were never needed. This was 10.5 years ago, and the tooth is still fine. Story 9. My mom took me to the ER because of a high fever. I was diagnosed with pneumonia, but for antibiotics, I needed to go to my house doctor. He brushed it off and said I didn't have it. A few weeks later, it expanded on my whole lungs and was very bad. My right lung died forever. I'm 33 now, and that happened when I was like 12. Answer: I had a similar thing happen where I was diagnosed with bronchitis at an urgent care clinic, but the antibiotics they gave me didn't work. I had to go back, and they finally got an x-ray and saw the pneumonia, and I got some stronger meds that cleared me up. This was less than a month before the first COVID cases were being reported from China, so it's kind of eerie looking back. Story 10. Told me the lumps on my cervix were just scar tissue, and he would contact me if the PAP smear was abnormal. He never did, so I assumed everything was normal. Close to 2 years later, I was diagnosed with cervical cancer, and instead of having a rather simple cone biopsy, to have part of my cervix removed, I had to have chemo and radiation, which put me into menopause in my early 30s. Story 11. You have hemorrhoids. It's not. Have you heard of CBT? Starts doing CBT and reading philosophy. How much faith do you have in science? Fired by my doctor and received a passive-aggressive letter from the MOAs where, funny enough, CBT could have been used. It wasn't hemorrhoids, it was stage 4 cancer. Left me without a doctor for a year where I almost died in the process. The silver lining is I finally have a doctor who knows their own field of expertise, still waiting on the specialists. Might die between now and then. Might be a stubborn mofo and stick around just to prove a point. Answer: I had a similar situation. My OB-GYN wanted to yank my entire reproductive system since I was bleeding very heavily. We had to do a biopsy, but my employer canceled my insurance. I went on Medicaid, and it was a good 6-7 months to get another chance at a biopsy after my imaging. I was written off as substances, seeking after admitting the over-the-counter stuff doesn't last long. I got told my uterus should bleed. It was stage 4 endometrial cancer, and I could feel the metastasis that made it stage 4 about 2 years before the official diagnosis. Story 12. Let my mom, who let her gestational diabetes run rampant, go overdue by almost 3 weeks, have a vaginal delivery. I was just under 10 lbs, and Mom is a tiny lady like 4 feet 10. I was completely blue and wasn't expected to live. I have mild cerebral palsy caused by lack of oxygen and head trauma from a violent forceps delivery. My mom and dad both definitely have PTSD from it as well. Answer: I had the exact same thing happen with my second pregnancy. My gestational diabetes and blood pressure went bonkers in my last month of pregnancy, but the doctors said everything would be fine. My son was almost 10 lbs and got stuck on his way out. They put off giving me a C-section too long and had to violently rip him out as both of our blood pressures were skyrocketing. My son ended up with a broken collarbone and his shoulder ripped through my cunt, taint, and butthole on the way out. I had a ruptured rectum that took a long time to heal, and there was a 150 chance I'd never poop normally again and have to get more surgeries. Thankfully, I can poop normally and my son turned out fine. He's a bit of a weirdo, but I don't think the violent birth caused it. Story 13. Not a doctor per se, but a chiropractor. I was 17, had fallen weird, and my lower back hurt like a fur. Docs and all said, go to this chiropractor and he'll help once the x-rays and MRI is in his hands. Well, he figured he'd fix me before they arrived. Lo and behold, ruined my lower spine forever because he wouldn't wait. Turned out I had a torn muscle. Edited due to typo. Answer: my Fael was a chiropractor and straight believes chiropractic care can cure anything. He and Mael were telling us about her sleep apnea and the equipment she has to use to sleep. He then explains exactly what happens with sleep apnea and finishes it off by saying that chiropractic care cures sleep apnea. Bless my sweet husband, who really never says a sharp word to anyone, for saying, then why haven't you cured her? The look on Fael's face as his hard drive spun around was priceless. Story 14. My cat bit straight through the fleshy part of my finger on my dominant hand while I was trying to dose him with a pill. My own doctor was not on duty that day, but there is a walk-in doctor service at the clinic I go to. I had an appointment with a walk-in doctor who looked up the treatment for cat bite on whatever reference system that doctors use and prescribed me some extra strength antibiotics. I asked her if she wanted to see the bite because it wasn't just a surface level puncture wound. He had gone deep through the pad with his top and bottom teeth. She said no. I asked again, just to be sure, because I didn't think that antibiotics was going to clear this up on its own, but she sent me away without looking at the bite at all. 2 or 3 days later, the pain and swelling was getting so bad that I knew I needed to go back and insist that a doctor actually look at the bite. This time, I actually did get my own doctor. She took a look at it and immediately advised that I was going to need surgery and sent in a referral to the specialist hand surgeon. She sent me home with more antibiotics and the strongest opiates I have ever been prescribed in my life. I had the surgery and was sent home with strict care instructions, more antibiotics, and more opiates. The skin on my finger eventually healed over, and I was able to stop taking the pills, but I am left with permanent altered sensation in that finger, as well as chronic nerve pain that doesn't respond to traditional treatments. Could any of this have been avoided if the first doctor had just looked at the bite and seen how serious it was when I asked her to? I don't know. Maybe, maybe not, but I will always be left wondering. Answer: if it's any consolation, it likely would have happened anyway. Granted, the doctor should have at least looked at it and probably washed it out very thoroughly, but at least you were given a good chance with the antibiotics. I see a lot of patients with really bad infections after cat bites, despite doing everything right. Unfortunately, they are just really nasty injuries. On story 15. Not me, my mom. She had a pap done, heard nothing and assumed it was fine. Then 2 years later, mom had abnormal bleeding from the female body part. She's fully postmenopause for 6 weeks before her doctor did anything. Her doctor just put in a referral and said no rush, I guess. Finally, she has enough pain to send her to the ER, and they take some scans. Lo and behold, she has uterine cancer. She goes through surgery in less than 5 days, then goes through chemo and then radiation for the next 10 months. She has more odd pain from her abdomen, and her ER doc tells her, you need another pap done, just to be sure. But what I want to know is, since your last PAP came back positive, why didn't your doctor do anything? Turns out she also needed a piece of her colon removed after her second PAP came back clear. Her colon had a severe infection that had been eluding her doctor for who knows how long. Anyways, question your doctors. They're people too, fully capable of being awesome, or shoot. Story 16. Tetracycline as a child. I am not allergic to penicillin, and it ruined my teeth, turning them black. I already had a difficult childhood, but never wanted to smile because of it. I had veneers done in my 20s, but the damage to my self-esteem has been pretty terrible. Answer: my husband and I both have tetracycline gray teeth because we both had recurrent tonsillitis as kids. In fairness, they didn't have much else in the way of antibiotics back then, and strep infections leading to rheumatic heart disease were them common and much feared. My dentist later said we were at least lucky to have had enough tetracycline throughout early childhood so that our teeth were of a uniform color. A lot of kids our age had a noticeable gray stripe across otherwise white teeth, the result of a single tetracycline treatment before permanent teeth came in. Story 17. Putting me on an antidepressant as a child. They never investigated or suggested therapy. My home life was bad and I didn't need a pill. I needed support in a better home life. I have since spent most of my life dealing with the side effects and withdrawal of trying to come off of them. Ironically, doctors continue to deny the reality of side effects, withdrawal being life-ruining. BTW, the substances I was put on, was later sued into oblivion for lying on safety trials for children, and doctors didn't believe me when I said it made me tragic end, just like the lawsuit revealed. So that first doctor who prescribed it, and every subsequent doctor after, have caused a domino effect of life-altering consequences for my health. Not sure if they'd admit to the mistake, though. Obvious disclaimer before anyone jumps in to misinterpret. Yes, antidepressants can be helpful for some. Yes, they can save lives. Yes, some people have no issues with them. This isn't about you. This is about those who were harmed by them and then gaslit by using those helped as justification. Two things can be true. These substances help and these substances eliminate. It's a sobering tension to hold. Answer: similar situation, but the shrink put me on a massive cocktail of substances, eventually 8 concurrent meds, a mixture of antipsychotics for refusing to go to school due to being constantly physically and verbally assaulted. I was overdosed continuously for over a year, gained a huge amount of weight, and showed signs of renal damage shortly afterwards. I've now been on dialysis for a little over 8 years, and the domino effect of renal failure has been significant. Story 18. When I was 13, I started having violent tachycardia and hyperventilating, horrendous nausea, couldn't sleep, and was roasting all the time. Kept happening in school, and they decided it must be that I was becoming a troublemaker and needed therapy. Me, the teacher's pet and gifted student who never had detention a day in her life or raised an eyebrow to an adult. They told my mother to just lock me outside to force me to get on the school bus until one day I genuinely thought I was going to have my chest burst open, and I begged my mother to help me. She drove me to school and they told her I should be admitted to a pediatric inpatient mental facility. They stuck me there for a fudge month while I kept shaking, vomiting, and feeling like I was going to die. The doctor at the facility dismissed me as being overly anxious and attention-seeking. Nothing changed when I got out after a month, and I can't even remember what triggered it, but I got someone to take my pulse, and it was over 200 BPM. They took me to the emergency room, tested me for substances and all sorts of stuff, and the attending came in and took one look at me and said to my mother, "Has her thyroid ever been checked?" No, because why would they test me when I was just seeking attention? Turns out I had severe hyperthyroidism, the highest numbers that doctor had ever seen in a person under 21, and she came back and told us I have first-year medical students who could have diagnosed this on day one. I was so overloaded with hormones, my body physically could not eat or sleep and sent my heart into unimaginable rates of tachycardia. I had to be put on adult levels of beta blockers to get my heart rate under control. I had actual damage from it being forced into that kind of beating for so long. I lost the ability to regulate it, and they tried for 2 years to control my thyroid with medication. I was on the highest possible doses, and it was barely doing anything. So when I was 15, I had to take a massive dose of radioactive iodine, I-131, to act as a lethal injection for my thyroid because they simply could not control it. And let me tell you, having to feel and go through one of your organs dying sucks. It sucks so much. I was cold, fatigued, bloated, nauseous, sore-necked for 6 months until they tested my blood. And it didn't work. It didn't work. I had turned into a shadow of myself that was homeschooled and could barely leave the house, and I had to do it over again. If a second dose didn't work, I was going to have a thyroidectomy. The second was worse, but it did finally work. I turned 40 this year. I still deal with tachycardia. My pulse can flare up and go off like you wouldn't believe. It's very hard for my body to regulate. I have to be super careful about caffeine. And that long of thyroid issues left me with infertility and anxiety and a lot of rage toward the medical community. Story 19. As a kid, I was always tired, like needed a nap after school, was too tired for afternoon recess. At puberty, I gained weight like crazy while eating next to nothing. My mom took me to the doctor repeatedly begging for labs for anemia, thyroid disease, and mono. My high school had an epidemic one year. 23 of the students were sick with it. The doctor literally wrote in my chart, "Patient's mother worries too much," and filed the labs without signing off on them. When I was 20 and HIPAA passed, I got a copy of my records. You can watch my thyroid die in real time over my teenage years. The labs were so out of range by the time I saw another doctor, I got thyroid hormone replacement right away. It was haschious. Turned out most of my family has it, but since we all saw the same practice, small town, this doctor missed all of it. One family member's labs were so horrendous, LabCorp called us directly and asked them to go to the ER. They could have died or gone into a coma. It literally stunted my growth. I'm the shortest in now 4 generations. I'm 40 and always cold except when I'm having heat stroke. Literally, I have crappy temperature regulation. I'm still tired more than most people and gain weight way too easily. I've tried different meds, different lab values. Basically, having my first 20 years without enough thyroid hormones has messed some stuff up. And new doctors wonder why I get copies of everything, check my medications at the pharmacy, and have zero chill. Story 20. My 5-month-old son had constant watery eyes and running nose and cried nonstop like he was miserable. I took him back to the doctor 3 times. First time, he said it was just a cold. Give him Tylenol for discomfort. Second time, it was probably allergies. Suggested child allergy meds. Third time, he was like, "Look, kids get runny noses all the time. It's common." A month later, I took him to free clinic for shots, and that doctor said right away that my son had glaucoma and needed eye surgery to relieve the pressure. 2 surgeries at Wills Eye Hospital later, and my son was 1,000 times better. But for all those months, the meds that idiot doctor told me to give my child was making his symptoms and pain worse, and it makes me so sad to know how my baby suffered. Story 21. They were multiple doctors. When I was a child, I had recurrent UTIs and they never did any tests and just gave me antibiotics. They ended up having to remove the left kidney. I kept having recurrent UTIs after removing the kidney, and the doctors who operated me kept denying anything was wrong. It was 3 years later that one doctor saw on the exams that they took me 3 years ago that I had urinary reflux. Basically urine coming back to the kidney recurrently. He operated me and I never had any more problems. But I was left with 1 kidney with decreased function and a serious mistrust in doctors. Story 22. OBGYN said I was touching my boobs too much, and that's why I was lactating when I have never been pregnant before. Took 2 years and an NP to figure out I had a brain tumor that now I will take meds for life for. Answer: prolactinoma. My doctor refused to believe I had one, even after I paid out of pocket for a prolactin test that showed my levels were way high. It took 7 more months in switching doctors to finally get someone to order an MRI, and by then it was 1.2 cm. They are usually smaller when they are found in women because the lack of periods tips doctors off to investigate. Story 23. Doctor and midwives didn't care about my morning sickness when I was pregnant. Screw the fact I threw up about 6 to 8 times a day from week 7 and basically just continued all the way into the delivery room. Yeah, I'm so not pushing for a second one. Answer: yeah, that doesn't even qualify as just morning sickness, and any doctor should have known that. It's hyperemesis gravidarum. I'm pretty sure anti-nausea meds saved either my life or at least my wallet, as I would have had permanent issues otherwise. I lost weight while growing a baby. Survived on yogurt, chips, and meals in a bottle. Thingies from the pharmacy. Story 24. Deciding that I had depression and not ADHD. It took me 40 years to get ADHD diagnosed and treated. There are all sorts of heartwarming, "I started my life late and my life is fantastic" stories out there. Well, all that does is reinforce how little progress I make, even as my theoretical best self. I can't even know if things would have been different with an early diagnosis, but I really wish I'd had that in my pocket to help manage my perception of what's personal failure and what's inappropriate expectations. Answer: we took my 13-year-old daughter in for testing with a psychiatrist. I wasn't sure what was going on with her, but knew it was beyond my husband and I. She was diagnosed with ADHD. That wasn't even on my radar as a possibility, but reading through information on ADHD afterwards was like crazy. Her behavior fit to a T. She wasn't bouncing off the walls, but had very little impulse control and lots of inattentive behaviors. She started meds and has been in a much better place. We got her set up on a 504 at school, and the school psych was amazed that we got her seen so quickly and diagnosed with ADHD. She said most girls tend to go through being diagnosed with depression or anxiety before they figure out it's actually ADHD. Story 25. Not a doctor, but an optometrist. Told them I had been having some double vision. They told me I was probably tired or had had too much to drink. Now, years later, I'm looking at potential eye surgery because it's too late for exercises to help. Story 26. One urologist just kind of laughed me off TBH. Experienced guy too. Thank God my GP had a relationship with the other urologist because that guy saved my balls. One of them anyway. Story 27. I had braces installed to fix my misaligned jaw and teeth, and they ate away at the base of my teeth irreparably. My gums started turning deep red, occasionally bleeding and swelling. It was not great, and on my bi-weekly checkups, I got some nasty words thrown at my face by the dentist for supposedly not brushing your teeth properly and sabotaging the entire procedure. At one point, I was brushing my teeth 5 times a day with no improvement. I eventually got sent to have my teeth professionally cleaned every 2 weeks. My parents had to pay for it and were pissed at me, despite knowing full well I was cleaning my teeth properly. The dentist that did the cleaning thought it was sketchy because no matter how well they cleaned, the swelling wasn't going. She was great, gave us a hint to have an allergy test done. The dentist was not happy, but did give us some samples for a skin allergy test, though she was a meanie and ended up billing us for the samples, out of pocket again, just like the cleaning. Not part of the procedure, so we had to pay. Result of the allergy test. Allergic to the glue or cement used to fix the braces to my teeth. Dentist didn't apologize for not believing me, only said, well, we can't take them out, nothing we can do. I would have had to keep those braces in for about 4 years. I ended up canceling the entire procedure. The swelling of my gums, though, enclosed some dirt that I couldn't brush away, which ended up eating away at my teeth. The bases of almost all my teeth is badly damaged from that, and most of the damage to my teeth nowadays originates from the base, according to my current new dentist. Story 28. I use the VA clinic for all my health care. As a woman, when you get a pap smear, the line is always, we'll call you if we find something. Well, one of my paps, they told me this, and I left and never received a call. So I thought, good, all is well. Then I changed doctors, and the next papo, 2 years later, came back abnormal. So I went to patient records to get copies of my previous pap, only for them to come back saying, we don't have them. Apparently the lab they sent my previous PA to sent the results back, and no one had ever opened them. So they weren't in records. Finally get the records back, and the previous pap also came back abnormal. I ended up with stage 1 cervical cancer and had to have a hysterectomy, and now I can't have kids. But the claim for damages ended up paying for a house and paid off my student loans. Story 29. I had to have my spleen removed following a car accident. The doctor stitched through my intestines, leading to a terrible infection. I almost died from the infection, and they had to open me back up to remove gallons of liquid shoot from my stomach cavity. They left the wound open to heal, and I had to stand in the shower at the hospital and push my stomach from both sides to try to squeeze all of the shoot out. I still have a massive hernia from it to this day and have a gnarly scar. Story 30. I was born with no irises. When having cataract surgery, I had some rings implanted as fake irises, albeit they don't close open, but would limit some of the light entering the eye. Unfortunately, the rings were not lined properly, and I now have triple vision within a 1 to 2 o'clock area of the circle of vision. I noticed it as soon as I woke up after surgery, but was told they would eventually settle. Apparently, my eyes are too fragile, and it is too risky to try and fix it. It made a significant change with things that I could do, and I've lost much work because of it. Story 31. I was prescribed tretinoin for my cystic acne. The only instructions I was told was not to put it near my eyes. My derm literally spent about 2 minutes with me after I waited for over an hour to see him. Didn't explain anything about building up the frequency of use or the sandwich method, and this was before tretinoin was super trendy online and there was lots of info. I wasn't told how drying or harsh it would be, and I was put on a high percentage right away because my skin was so bad. I did not put it near my eyes, but noticed gradual and increasing eye pain and dryness. It got to the point I would sit on my couch and sob because my eyes hurt so much. I told my dermatologist about it the next time I saw him, and he told me it's completely fine and to keep sticking with it because my acne was still so bad. So I stuck with tretinoin for 9 months. Throughout this time, I saw 3 ophthalmologists, and finally the third ophthalmologist told me tretinoin was destroying my tear glands and to stop using it. I stopped and my eyes never recovered. I have to use excruciatingly expensive prescription eye drops and a nasal spray that stimulates tear production for the rest of my life. And my eyes are still dry and still hurt. I'll regret using tretinoin for the rest of my life. The worst part is, it did very little for my acne. It totally fudged up my skin barrier, and ultimately, birth control fixed my cystic acne. Story 32. They told me it's probably nothing. It was cancer, it spread, and now I live with a ticking clock that could have been stopped early. Answer, I got told I was imagining all the pain I still had after my gallbladder was taken out due to gallstones. My doctors dicked around and treated me like a substances seeker when I was in constant 810 pain. I emergency married my fiancé months before our wedding so he could take me to the VA hospital. Within a week, the VA doctors figured out that I had gallstones trapped in my bile duct in stage 2 pancreatic cancer. I had surgery right away and beat the cancer. If I had stayed with my original doctors, I would have died. Story 33. Had an ongoing dull pain in my chest back that eventually motivated me to go see a doctor. He told me I was sleeping wrong and gave me muscle relaxers. Pain lingered anyway. 2 weeks later, pain has grown so intense, I finally go to emergency room. Turns out I have a thoracic aortic aneurysm. Finally get some morphine is administered. Never felt so good, I see why people get addicted to opiates. Soon have surgery for stent placement in my artery. During the surgery, I have 14 embolic strokes. Wake up from surgery and realize I can't use my hands with any articulation. End up doing 5 months of neurotherapy just to learn how to walk smoothly and be able to actually open a bottle of water. That was my own litmus test. So no, the original mistaken doctor didn't cause the aneurysm, but he certainly didn't listen or investigate to a reasonable extent. I don't think doctors are magic or God, but that was bullshit. I used to be great at typing. This crap right here just took me 15 minutes. My job prospects have diminished quite a bit. Story 34. I was overprescribed antibiotics when I was a very small child and had a very weak immune system. It absolutely wrecked my gut biome, and every dentist who's ever looked at my teeth have asked me if I was on a lot of antibiotics when I was young, because I have always had very little enamel on my teeth. As someone with a family history of IBS, I didn't stand a chance, and my teeth have been fudged up since I was a kid. I'm getting the IBS under control as an adult, but the teeth problems have been hell, and I'm going to end up with dentures before I'm 40. My mom was mostly transparent about this when I was a kid, but never liked talking about why she didn't choose to join the several other families whose kids were overprescribed stuff by this pediatrician and do something about it. Instead, from what I understand, he got to retire and we all just ended up messed up. Story 35. My mom fell while she was 6.5 months pregnant. The on-call doctor tried to send her home, but she refused. He still left her without care for most of a day while she got her doctor on a phone, pre-mobile phones, and he organized care and traveled across the state to get to my mom. By the time he got there, we were both almost dead. My mom is emotionally scarred for life, and I have multiple disabilities including vision, hearing, and physical impairment. Story 36. When I had my wisdom teeth removed, the surgeon accidentally nicked a nerve. So the right side of my lower lip and chin has messed up sensation. I tap my chin and feel it in my lip, for instance. But considering the tooth on the other side was at a 90-degree angle, I'm not super bothered. And it's healed pretty decently since it happened. Vitamins FTW. Story 37. A failed lumbar surgery. I kept telling the surgeon something was wrong, but all I got was, oh, it's okay. That's normal. 35 years of living with level 6 pain. Story 38. I heard a popping noise in my shoulder while at work moving boxes. I went on workers' comp because breathing was hard and I was in pain. I spent the next year or so getting x-rays, MRI arthrograms, physical therapy, and other treatments. I was eventually diagnosed as having a permanent injury, and FedEx is supposed to cover anything costs associated with my shoulder. Whole bunch of bullshit because they ignore everything and deny it's associated with the workers' comp claim. Anyway, a few years later, someone said it sounded like I had a rib head out, went to see her, and she was able to get the rib head back, in which really helped. However, the years of my rib head being out caused issues with my middle and lower traps not activating, arthritis in my neck, which required surgery, and I've been getting consistent massage to manage my neck and shoulder issues. Doctors never diagnosed anything with my shoulder, but were happy to close the claim and just say it's permanent. I was in excellent physical shape, was 160 and 10. I was very fit, and they would just say, shoot, like I wish I had that bone structure and fitness. Advocate for yourself. Story 39. Not but my dad. His doctor told him it was just a long, dragged-out cold. It was in fact pretty aggressive prostate cancer. Only because my dad did his own research, he found out it might be cancer, and he had to pressure his doctor to make tests. Due to the delay by the doctor, it had already spread, and now it's not curable, only treatable. The operation also severely impacted his lymphatic system, and he already had sepsis several times due to it. My sister and I were still underage when it happened, while my father was already a single father. The doctor's mistake nearly cost my father's life and would have left my sister and I as orphans. Luckily, my dad survived, but he still struggles with cancer and the aftermath of the operation. Story 40. When I started experiencing leg pain in 2010, the first doctor I went to diagnosed it as tendonitis in my right knee. He then decided that the damage was too bad to refer to surgery or physical therapy. He also refused to recommend anything for the pain aside from a leave. Even though I have a history of acid reflux, it took 3 years to get in with another doctor in my hometown that diagnosed the pain as bursitis, and I did shots in my hip every 6 months for another 3 years, until he got fired for malpractice due to something that happened during multiple knee surgeries. So it took another year to get into a doctor that specialized in leg injuries. The first thing he did was order 6 weeks of physical therapy and MRIs on my knee and hip. The MRI confirmed the tendonitis in my knee, but also indicated a labral tear in my right hip. He then ordered another round of physical therapy and prescribed me some stronger pain medication, prescription strength Tylenol, so it didn't fudge up my stomach even more. After the second round of physical therapy, he referred me to a surgeon that specialized in labral repairs. A few months later, I had surgery where my torn labrum was repaired and my hip bone had to be reshaped. My surgery was in 2017. I still have knee pain. My tendonitis isn't going away anytime soon, but I am mostly pain-free in my hip, except for when that area gets cold. For some reason, the cold makes the bone and the scar tissue ache. Plus, I still do a lot of my physical therapy exercises I learned to help with mobility and flexibility. Story 41. I had a dentist who basically thought I couldn't handle any intensive dental work, hygienist appointments, root canals, major fillings, etc. So just kind of lied that my teeth were fine, regardless of how much I brushed or flossed them. So I spent like 20-30 years oblivious to the fact I wasn't looking after my health properly and had no idea how to actually care for my teeth. Then when I got a toothache and went to the emergency clinic, it ended up leaving me with the need to find a new dentist, months of appointments and bits of remedial work, etc. It also came out a while ago that someone else had sued the same dentist for not doing their job properly as well. Answer: the thing that makes this so tough is that lots of dentists do the exact opposite. More often than not, when you go to a new dentist and they say you need months of appointments and bits of remedial work, it's because the new dentist is lying committing fraud. So if one dentist says you're fine and another says you need a ton of work, it's very hard to know which one to trust. Story 42. Been treated for borderline personality disorder when it was pretty darn apparent that I'm just autistic, as is my mom, but nobody cared enough to give a shoot. Story 43 pales in comparison to some of these, but they did not realize the grommets inserted during surgery had not fallen more than a year after I had my tonsils removed. I got an ear infection, and due to complications related to both the infection and the remaining grommet, I ended up with permanent hearing loss. I've been largely deaf in one ear ever since. Cheers. Story 44. Not kid one doctor, but a whole series. I was born with a mild form of spina bifida, but still bad enough to have a big scar on my lower back. Over the years, a tumor developed and I had problems with peeing. This got worse and worse, and my parents tried to get a good analysis from doctors, but they dismissed it as a psychological problem. Despite having a tumor as big as a third buttock and me being far too small for my age and looking like a Biafra kid. Anyway, the tumor eliminated my bladder nerves. I was incontinent and almost eliminate my kidneys. That almost eliminate the rest of me. Got a urostomy and have a pee bag for the rest of my life. If only one of them had listened to my parents or had a good look at me. Story 45. My pediatrician has thought too many kids were getting their tonsils removed prematurely, and I would grow out of it. I had strep throat 17 times as a kid. She still said I shouldn't get them removed. Funny enough, I was in med school and my ENT instructor was demonstrating on me when they asked why the hell I still had my tonsils. I had chronic strep by then and would get a bacterial infection every time I got a cold, or stayed up too late, drank adult beverage. All dairy made me sick and I kept getting stones in my tongue. I got them taken out as an adult, which made recovery significantly worse than if I had done it as a kid. I think I'm balanced out now, but being on all those antibiotics all the time couldn't have been good for me. My parents wish they had insisted, but they trusted my pediatrician. My mom still gets pissed off about it. Story 46. My surgeon left me on the table under anesthesia for 12 hours so he could work on another patient. I woke up with permanent vision loss in both eyes. He never even spoke to me after the surgery. He ruined my life. I'm not allowed to drive, and my prospects of furthering my career have vanished. I have daily panic attacks because I am so disoriented all the time. When I asked why this happened, I was told it was due to surgical anxiety. So it's my fault. Story 47. Not me, my son. When he was not quite one in breastfeeding, his mother's doctor prescribed an antibiotic tablet for a whitlow on her finger. I won't go into the symptoms beyond. He began to retain fluid alarmingly and started to get really sick. Cutting a long story short, the tablet fudged his kidneys. A long stint in hospital and his mother being driven half mad trying to keep his medications at home. Working ruined our family life to a large extent, with his older brother having to make do along the way. Yeah, the DR's fault. One, that he knew she was breastfeeding and there was a chance something like this would happen. Two, it wasn't a whitlow. It was a bone cyst, which required an operation, not an antibiotic. I am very bitter and angry towards that DR, but proving it would be nigh on impossible. It's 35 years later. So much of his life has been spent in and out of hospital. He had to go on to dialysis for a long time until he was able to get a transplant. I wanted to be a donor, but his nephrologist said no. Now that transplant is failing and some kind of blood cancer has appeared in the last few weeks, possibly the result of the immunosuppressants. And through it all, he's been a dad and soldiered on with a smile, trying to help me with my health, which isn't the best. He's a fudge legend. Am I bitter? Oh, shoot, yeah. Story 48. Misdiagnosis of herpes at 18. Doctor barely looked at me, did cursory visual exam, lectured me, had medical student with her. I was so embarrassed and felt dirty. This was my first intimacy partner. For years, I had to let partners know. I was terrified of spreading it. I lived at home at the time. Years later, I had an outbreak again. Got tested and examined. Not herpes. Story 49. Born with congenital cataracts, had a surgery at 1 week old to get them removed. Surgeon wasn't prepared for how difficult it would be, and I ended up with complications that progressed to glaucoma. Now I'm fully blind in my right eye, with a risk of losing the left as well. Story 50. My mom had a stomach ache for a year. Her doctor told her to lose weight, go gluten-free, drink less, eat less sugar, as she was pre-diabetic. By the time she collapsed and they finally scanned her abdomen, the cancer had eaten her pancreas and was working on her liver. We got 17 more days with her. Story 51. I was misdiagnosed and dismissed for over 30 years before a congenital brain abnormality was found compressing my brainstem. Even then, doctor after doctor, 5 neurosurgeons and 2 neurologists just to start, dismissed it as being the cause of my scattershot neurological problems, though by then my symptoms were so severe and progressing so rapidly, they did at least recognize something was seriously wrong. I had surgery by a world expert on the condition 10 years ago, and it gave me renewed life, but one still marked by permanent disability. The brainstem does not take kindly to decades of compression, which coupled with thick adhesions gluing the area shut over time, resulted in a 100 blockage of CSF flow. I have permanent autonomic nervous system dysfunction affecting my cardiovascular, respiratory, metabolic, digestive, and muscular skeletal systems from the decades of damage. Story 52. Not me, but my mother. She was complaining of difficulty breathing, went to her GP, and she told her it was a result of constipation and that my mother should lay off of dairy. My mom went back, said that she modified her diet, but still had difficulty breathing. Doctor again said it was related to her diet. To be fair, my mother was a bit overweight but not obese. She took steps to improve her weight, but still had breathing issues. Went back to the doctor, same thing. You just need to lose weight and stop eating cheese. This dance continued for like 6 months. Finally, my mother gets fed up, gets a second opinion. This time, the new doctor believed her. They ordered some scans for her, and they came to find nearly a liter of fluid in one of her lungs. It was lung cancer, stage 4. It had already spread to other parts of her body. She passed about a year ago after a few years of treatments. With her new doctor, she had an amazing care team, and I can't speak highly of them enough. Northwestern medicine, for folks who are interested, she had a unique form of cancer that was spurred on by her genetics. They hooked her up with a forerunner in the field of research around her form of cancer. I can't help but wonder what would have happened if the first doctor had believed my mother and took the time to simply order a scan. My mother still would have died, but would she have gotten an extra few months? Years? Would she have lived long enough to see her eldest grandchild graduate college? Who knows? Story 53. Not me personally, but about 10 years ago, a family friend had been dealing with severe lower back pain and a slew of other symptoms like bloody urine. He went to a clinic. The doctor there dismissed him and told him to take Advil. A week later, he's hospitalized and diagnosed with stage 4 bladder cancer. They caught it too late, and he passed away a month later, left behind his young family. Turned out the doctor had a history of being terrible at his job before this too. Story 54. Not me, but a coworker who doesn't use Reddit. She's admittedly overweight, probably over 300 lbs, but generally healthy. About 2 years ago, she suddenly started losing a lot of weight out of nowhere, like nearly 50 pounds in 2 months. She hadn't changed her diet or anything else about her lifestyle. You don't have to be a medical professional to know that sudden, dramatic weight loss without any lifestyle changes is a sign of a medical issue. So she went to her doctor. Her doctor didn't see the problem. After all, she was fat and losing weight when your fat is good. Wasn't she happy to be losing weight? He paid zero attention to the context of the weight loss. His entire thought process was, fat person is now less fat. This can only be a good thing. Thankfully, my coworker is a very stubborn person and immediately went looking for another doctor. Thankfully, she was able to find one, taking on new patients on short notice. That doctor actually listened, agreed that her weight loss was concerning, and ordered a bunch of tests. Turned out my coworker's weight loss, which her first doctor insisted could only be a good thing, was the result of fudge intestinal cancer. After surgery and chemo, she's doing pretty good now. But if she'd taken that first doctor at his word, she most likely would have died. Story 55. Misdiagnosed mental health crisis as depression, increased antidepressants 300 causing major manic episode and diagnosis of bipolar. Story 56. My eldest brother had braces when he was a young teen, and they also put him on steroids for a chronic issue. This led to pretty much all his teeth becoming some variation of rotted, which I believe fed into his chronic depression, which indirectly led to his passing. My mother visited the doctor last year in March, saying she didn't feel well and struggled to breathe. Her heart was also doing funny things. We later found it was a fib. Doctor said, well, we can out you on oxygen, but you look fine to me. Come Thanksgiving, she was struggling to breathe going from the living room to the bathroom and back. Doctor said, well, okay, maybe it's an URI, and gave her a week's worth of antibiotics. A month and a half later, she's in the hospital with severe pneumonia because her O2 levels were in the low 60s. Story 57. A psychiatrist told me she didn't see a reason for me to take meds. I had tragic end thoughts, a few attempts, and was barely holding on. If my last attempt, 4 months after that visit, was successful, I'd be long dead now. Story 58. An old doctor gave me a real heavy antidepressant after one short appointment. He didn't care. He just shoved the prescription in my face. It was so bad that I stopped after 3 days, and I didn't see it as an option anymore. 20 years later, I got something from my current doctor that helps me out so much that I feel that I've lost so much time and quality of life because of that one bad experience. Story 59. Hip replacement. Doc never measured my legs. The morning of surgery, looked at my legs on the bed and eyeballed it that I needed a half-inch added. He was wrong. I had no bone loss and know my left leg is half-inch longer from the hem. I know this sounds pretty mild compared to so many of the other stories here, but it's my story, and to me it's been a nightmare. Walking for long distances make my shorter leg's hip hurt pretty bad. For those who live in Illinois, avoid IBJI. They herd people through like cattle. Story 60. My mom got a new doctor when her doctor retired. She went to him complaining of pain in her shoulder and neck, gave her a little pain meds and sent her in her way. Went back a few weeks later, pain is getting worse. New doc just assumes my mom is a pain meds addict, despite having nothing like that on her medical record, and sends her away. This goes on for a few months. Doctor never runs any additional tests. Finally, mom reaches out to old doctor who contacts someone else to get her in for tests. Turns out she was now at stage 4 non-Hodgkin's lymphoma. Only lived for about 9 more months. Those 5 months could have saved her life. Now I don't have a mom. Story 61. When I was 4 years old, I fell off the monkey bars and broke my arm in 3 places, 2 in elbow, 1 in wrist. The doctor out in the boondocks of Pennsylvania only fixed 2 spots, 1 elbow, 1 wrist. After my arm healed and the cast was removed, my parents noticed that my arm wasn't straight. Went back, doctor said it's just a cosmetic issue and not worth re-breaking and rehealing. Fake news, I have quite a few issues doing bicep and tricep exercises with that arm. Not as bad as the other stories on here, but still kind of ridiculous. Story 62. My wife felt a small lump in her breast when she was 29. It was small, but I could also feel it. So she went to her OBGYN for her annual appointment a couple of weeks later and brought it up. The doctor told her not to worry about it because of her age and lack of family history of breast cancer. We felt relieved. A year later, the lump was still there. Brought it up again, and they finally agreed to do an ultrasound and then a biopsy. Lo and behold, she had an aggressive form of breast cancer. When she had the surgery to remove her breast, they also took some lymph nodes from under her arm, which were positive for cancer, meaning it had started to spread. If the doctor had taken it seriously a year earlier, the cancer may not have spread. We will never know. But I do know that the last 8 years of treatment, from surgery, reconstructive surgery, chemotherapy, hormone therapy, and then treatments to fight the side effects of those treatments, has been hell, an expensive hell. Story 63. 7 doctors told me, "You're too young for this kind of pain," for almost 3 years. Finally found a doctor who believed me and ordered all the tests. My vitamin D was so low it would have been fatal in a couple of months. Luckily, I am alive. Unluckily, I have permanent neurological damage. So I will be in pain for the rest of my life. Story 64. When I just got my first car, I drove myself all the way into Toronto to visit Camsh. I was having dark thoughts. That felt like more than the generalized depression my GP insisted on. After my visit to Cam, they said they'd call me in 2 weeks. That phone call never came. I was on varying doses of Zoloft for up to 6 years, but eventually stopped taking it because it made me feel numb. My depression was only general anyway, right? Wrong, as I found out in hospital, 6 months after waking from a medically induced coma, because yeah, I attempted. I am clinically depressed. I lost 15 of what's in my head due to a traumatic brain injury, TBI. Honestly, can't help but feeling all of this could have been avoided had I got that phone call. Story 65. Didn't take my stomach pain seriously. Ended up losing half of my large intestine, literally almost dying in extremely painful passing, and have an ileostomy. I'm a woman with chronic health issues, BTW. So frustrating. Story 66. When I was 19, I went to the ER with sharp stomach pain. Doc brushed it off as probably gas and sent me home with Tums. 3 days later, my appendix burst. By the time I got back to the hospital, I was septic, ICU, surgery, the whole mess. I lived, but the infection damaged a bunch of tissue. Now I've got chronic abdominal pain, digestion issues, and a scar that looks like I lost a knife fight. Every doctor since then just shrugs and says, "Yeah, that'll happen. So yeah, thanks for the gas pills, doc." Story 67. Oncologist kept telling my father his cough was allergies and to take over-the-counter cough meds. Several weeks of this go by. Eventually, he ended up in the emergency room via ambulance for what was found to be double lung pneumonia. He died 3 days later. Fudge Meanie was too lazy and dismissive to order a chest x-ray. I hope she rots in hell. Story 68. I, a woman in her early 20s at the time, asked my gyno to do sterilization surgery, specifically a bilateral salpingectomy, a complete removal of the fallopian tubes, because I didn't want kids and I didn't want a period. After I woke up from surgery, she informed me she did a tube tie. Instead of removing my tubes, in case I changed my mind about kids later, I knew about that surgery, and I specifically didn't want that one due to the unnecessary risks. Can still get pregnant, higher chance of ectopic pregnancy, clamps can migrate and hurt other organs. So that was 2 years ago, and I have random cramping and constant fear of pregnancy or ectopic pregnancy, which are fears I wanted removed when I decided to get sterilized. Story 69. Childhood obesity and having a military upbringing did not mix well in the 90s. I struggled throughout my entire childhood to figure out why I was always hungry, exhausted, and cold. My body was constantly fatigued, and I was having a really hard time focusing in school because of it. It didn't matter how much I slept or exercised or tried to discipline myself. I always felt tired and eventually got depressed. My doctors would only comment on my weight and tell me I needed to exercise more. I failed so many diets before I turned 18. I can even remember the number of times I tried to lose weight, and I couldn't lose more than 5 pounds, even after adhering to a 1,500-calorie diet for 2 months straight. I was hungry to the point of feeling nauseated every day. I would eat a meal, and then an hour later be hungry for another meal. And when I felt hungry, I also felt anxious. So I kept eating, and my doctors kept telling me I needed to lose weight. I kept trying until I got so depressed and anxious that I stopped doing anything at all besides the bare minimum of waking up, going to school, coming home, and lying on my bed for hours. And I was so cold all the time. We lived in Texas for many of those years, and it's a hot place. I went in for a routine checkup with a new PCM at 17 years old, and she found a lump when she felt around my neck, sent me for an endoscopy, took some CTs. I had an 11-millimeter tumor on my thyroid. It was large enough that it had deviated my trachea, which is why I had been getting food stuck in my throat and needing to wash small bites down with water for years. She told me it had been growing for a long time, many years. It ended up being benign, and now I just have to take a pill once a day for the rest of my life. But I accrued almost 2 decades of medical trauma and self-image issues from being gaslit into believing that I was the cause of my obesity. We later found out I also have ADHD and a metabolic condition that has responded well to GLP-1s. And from nobody even noticing that there was a tumor on my neck because of it. Cold, tired, fat kid who can't get any sleep or swallow food without pain is just lazy and unmotivated, right? The 90s were good in some ways, but they really sucked in this way. Story 70. Deep root canal that had to be redone a few times. Now 10 plus years later is time to redo it, and I'm not looking forward to it. Nor do I have the money to take care of it, especially if there's more mistakes to redo. Story 71. I have wonderful doctors right now, but in general, I think doctors need to learn to say, I don't know, when they don't, which is often. Story 72. Prescribed me prednisone for an allergic reaction. I have Ehlers-Danlos syndrome, which he knew about, and had a rare complication that severely weakened all the connective tissue in my body. My pelvis failed, leaving me crippled. My fingers weakened so badly that I couldn't use my hands for years, and now have to use a full set of ring splints to do much of anything. My organs drop every time I stand up because connective tissue keeps those in place too. In other news, medical malpractice in Florida is a huge joke. Having no medical malpractice laws would be better than what we have. There is no recourse for many people who are badly injured or permanently disabled by a careless doctor like I was. Story 73. Not quite a mistake, but the doctor I saw after getting hurt at work was the one the company recommended, as I was new to the area. I got denied any workers' comp past the free doctor appointments and now have permanent pain. Story 74. Had a Jones fracture on my left foot, went to surgery where they put a screw in it. When the cast came off, I saw that my toe was turned out away from my other toes. Doc said it was just the swelling. Definitely wasn't. It's very painful to walk on now, and putting socks on is like trying to get Barbie's hand through a shirt. Story 75. I needed to pull out a tooth because of a doctor mistake, but I guess that is nothing. Could be much, much worse. Story 76. Surgeon cut something they weren't meant to during surgery, and now my right ankle and all the joints in my right foot don't work the way they should. Story 77. They refused to do a CT on my dad's spine, leaving him bedridden for 2 weeks before the infection in his spine caused his blood pressure to spike and his brain to bleed. Then, during the transfer from one hospital to another, the first one decided not to give him the blood thinner reversal substances because the second one didn't expressly tell them to. Eat it to add, the consequences of this are that I have to live the rest of my life without my father. Story 78. You don't need physical therapy. No one teaches a baby how to walk. They just do. I was 26 and was recovering from a broken femur. Turns out 26-year-olds that have permanent pain will need to be retaught how to walk without fudge up the rest of their body. Still mad at that jerk hole, and my hip, knee, and back hurt worse than the broken femur 16 years later. Story 79. I had ICP during my first pregnancy. My doctor should have performed a C-section as soon as the baby was healthy enough, as this condition can lead to stillbirth. I lost my baby girl at 12 months pregnant. She was stillborn. Story 80. I had multiple doctors blow off female health stuff for years. The issues turned into uterine cancer, and I had a hysterectomy a couple days before I turned 30. Now I can't have any more kids. Have one. If they would have listened to me and helped me with my issues, it all could have been avoided. I'm 32 later this month, and anger from the whole situation hits me in waves sometimes. Story 81. Last year, literally a few days after my little brother graduated from high school, My grandma started having pain in one of her arms, so I suggested that she go to the hospital. She did, and they sent her back saying it was just stress. Before the end of that month, it started up again, so she went again. The doctors this time said she had a heart attack, and that she had one the last time she was there. She ended up dying a week later. I had to bury her ashes. My father had also died 3 years prior, and my mother couldn't give a rat's jerk about me. Story 82. I had a stroke at 17 because a gynecologist gave me a birth control. No, not for the reasons you think. I have terrible periods, with a high risk of stroke due to too much estrogen. It's been 4 years and I still have problems, mainly with my memory. Story 83. PCP diagnosed me with a sinus infection after a 30-second exam. No exaggeration here, actually 30 seconds. I was actually having a stroke and have what appears to be permanent vision loss as a result of that delay in appropriate care. Story 84. Decided to do the routine surgery on my dad, even though his BP was through the roof. Decided to artificially lower BP via anesthesia, and the boom, he was dead 24 hours later. Nearly a decade later, I can see slightly better. I will never be the same, and I miss him terribly. Story 85. My sibling died of cancer in their early 40s because their GP repeatedly brushed off their symptoms. I now live without a sibling and with hypochondria. Story 86. Convinced me to eliminate my thyroid rather than treat my hyperthyroidism, Graves' disease. I am now thoroughly hypothyroid, have gained 40 pounds, and absolutely dislike myself every single day. Story 87. My mom had cancer in her trachea. The tumor blocked off one lung and it collapsed. After the surgery to remove the lung, she went into atrial fibrillation, so the surgeon put her on amiodarone. If you Google amiodarone, the big warning on it says to never give it to patients with decreased lung capacity. After 30 days, literally the day before we were supposed to go back to the hospital for her 1-month follow-up, she started having trouble breathing. She was diagnosed with pulmonary hypertension. Her cardiologist said she never should have been put on amiodarone, but when he heard me repeat that, he started backpedaling. We consulted an attorney, but he said it would be difficult to prove malpractice, as we would have to prove no reasonable doctor would have put her on amiodarone, and it's a very common treatment for atrial fibrillation. She had to be on oxygen from then on and lived 2 more years. I fully believe that surgeon eliminated my mom by putting her on amiodarone. If he had paid attention to the warning, she would have had a different ending. But I can't change it. Thank you for watching the video all the way to the end. If you'd like to see more content like this, you might be interested to know that I've created another channel with a similar theme, especially for those of you who enjoy what I do. I'll leave a link in the description, and I hope to see you there. Take care.